If you or someone you love suffers from migraine headaches, well, permanent relief could be as close as your back door. I want to introduce two very special guests. Dr. Kevin Rose, first of all, from the Rose Clinic, and Pam Wright, who, do I dare say, a former migraine sufferer? Is that accurate?
Safe to say.
Wow, this is exciting. We'll talk to you in just a minute, Pam, but first I want to talk to Dr. Rose about this breakthrough procedure, because a lot of us didn't realize that there was actually a surgery to provide migraine relief. What is this procedure and how did you find it?
Well, you know, as a plastic surgeon, I never in a million years thought I was going to be doing, treating patients for migraine headaches.
Yeah, you thought you were doing nose jobs and forehead rejuvenation, all of that.
I mean, I basically specialize in breast and body contouring, liposuction, tummy tucks, that kind of stuff. And we happened upon it by accident. And in doing forehead rejuvenation type procedures, we basically found out that many of those patients that came for the cosmetic surgery also happened to have migraine headaches, and after the procedure they were noticing significant relief. And then also neurologists around the same time were also starting to use Botox to treat migraine headaches. And so we put two and two together, and one thing led to another, and we did multiple studies. And basically at this point now we have 4 different trigger sites, and the thing that's nice about it is that we're able to use Botox to find out if a patient could potentially respond to surgery. So we don't just jump right in and do surgery.
Okay, that's what I wanted to know, because you're talking about Botox and the trigger points, and I remember seeing Pam get that treatment. So what do? You inject the Botox into these trigger points to see if that affects the migraine or triggers the migraine? Is that kind of how it works? Or
we see if it alleviates the migraine. If they get greater than a 50% reduction in either the frequency, severity, or duration of the headaches, then we know that the surgery will probably do exactly the same thing that the Botox did. And so that it allows us to test the different sites, and we do one at a time so that we're able to figure out where the patient's trigger sites are.
All right, so you're talking about the studies that have been done. What kind of effective rate have you seen in these studies? Wasn't an article, didn't it come out in JAMA just a little while back?
It was actually in Plastic and Reconstructive Surgery. It came out in January of this year, and it was a study done by Dr. Bauman Gairon in Cleveland, Ohio.
Who you studied with.
And I studied with him for 6 months and did about 40 of the different surgeries with him during that period of time, but we had great success. I mean, it was fantastic. I saw people come back that had their life back, were giving Dr. Gairon a big hug, and it was amazing to see. And I just felt that I needed to be a part of this because it made such a significant difference in people's lives. But the numbers are 92%. Basically what that means is that if the Botox helps you, the surgery also has a 92% chance of doing the same thing that the Botox does.
All right, we can hear that 92% effective rate, but that doesn't mean anything. Why don't we go to the one person sitting right here who's actually had this surgery? Are you a success story?
I am. We did the surgery back in January, and 3 months later, to this day, I still have not had a migraine headache.
And how frequently did you get them before?
I would have them, out of an entire month, I would have 3 days without a headache, and that was it.
How did you survive like that? With migraine headaches?
Yes, it was not easy. I'd go do the work at Mountain View Hospital, I'd go throw up, and then I'd go back and do more cases.
And you're a nurse at Mountain View, right?
I'm a certified surgical technologist, yeah. I work with Dr. Rose, as a matter of fact, in surgery.
So were you skeptical at all? Because you're a nurse and you know this field. Were you thinking, no way, surgery to cure a migraine?
Well, I was very skeptical at first because for so many years all my doctor says, well, here's some pain medication, try this. After a while you just get so immune to it, you don't even have success from the headaches, relief for the headaches at all. So, yeah. And I was very skeptical, and I told him that. And he says, no, I promise, just try it. And I tried it, and the Botox even made a huge difference. And then he suggested the surgery, and I said, okay, let's go for it.
Well, Pam, I am so thrilled for you. You look like a new person.
I feel like a new person.
You're glowing. You're so happy. And so you have Dr. Rose to thank for this.
Yes,
thank
I
you.
do.
Thank you both for being here. We want to let you know that if you would like more information on this new procedure for hopefully curing your migraine headache, please contact the Rose Clinic. There's the address on your screen, 374 East, 400 South. That's Suite 3 in Springville, Utah. And the phone number is 491-8222. We also have all of this information and the website for the Rose Clinic on our website at abc4.tv. Pam, thank you so very much. And Dr. Rose, continue the good work.
Thank you so much.
We hope a lot of our Utahns will be cured from their migraines as well.